I would certainly be concerned about the abandoning of the biological definitions of male and female and using non-binary as a medical definition. So much of medicine is based on biology and is based on differences between male and female that it raises all kinds of ethical and medical questions about treating various illnesses and how we should approach the way we treat patients. I think there are lots of problems with self-declaring gender. There are issues around the fact that if we make it that it's not a medical problem, that raises issues around the fact that currently people who wish to change their gender are seeking medical treatment to do that and surgical treatment, which if it's not a medical condition, then why does it need medical and surgical treatment? I think the other issue is that if people can just self-declare and they can go and seek medical treatment and say that they are a different gender to their biological gender, then that changes the way we treat them, or it could change the way we treat them. For example, if they said they were male and they were in fact female, they could potentially be pregnant and we wouldn't know that. And there's also the big issue of children and young people being able to self-declare their gender as well, which brings a whole raft of other issues. I think the period at the moment of waiting before you can get a gender recognition certificate is actually really important. People who are seeking a gender recognition certificate are often people who have other concurrent mental health problems and they need time to decide whether actually this is something that they do wish to do long term. Some people do find that living as the opposite sex is something that they do find helps them in the long term. However, there are also many people who realise after a period of time that actually living as the opposite sex doesn't solve all of the issues that they had, and that actually they prefer then to return to living as their biological sex. I think there's also a big issue amongst children and adolescents. Adolescence goes up until the age of 25, as we're very much realising, and during that time, as we know, young people change their minds about what they want for the future, about how they view things, and to be able to make decisions about their gender, which may have long-term repercussions, is something that needs to be done over time, and they need to be given time to explore that fully. I'm particularly worried about the clause which is talking about under 18s. So as a paediatrician, that's what particularly bothers me. Children are going through a period of growth and change up to the age of 18. Many of them are still going through puberty or have only just gone through puberty, and to be making decisions about their gender identity at a time when trying to find their identity is part of what they're doing as they grow up is really dangerous. And when you're talking about even younger children, that's even more of a concern, because often that may well be adults around them raising those issues rather than the child themselves, who really is not capable of making those kind of decisions. We do talk about Gillick competence and children being competent to consent for themselves, but actually in this particular situation I don't see how an under 18-year-old can actually consent to living as the opposite sex when they have no real understanding of what that means and what that might mean for the future if they were to go through full gender reassignment. They find it difficult to see past the next year or 2 years, let alone the rest of their lives.